Okay.
On the Pablo Show, we have the world's best in everything, not only athletes, actors, musicians, but also doctors. With us, world-renowned plastic surgeon, Dr. Michael Omidi. Doctor, tell everyone what your specialty is.
Hi, Pablo. How are you? Thank you for having me. I'm a board-certified plastic surgeon. I specialize on the face. I also do quite a bit of breast and body work, Brazilian butt lifts, mommy makeovers, liposuction, and also a lot of facial fillers, lasers, and rejuvenation procedures.
First of all, I have to get my free consult in. How does the nose look? Broken playing basketball.
You're going to do consultations for that one.
That looks okay, right?
Yeah, actually, it looks good on your face. It looks nice and masculine and goes perfect with the hairline.
See, that's awesome, Doc. I love my shaved head. It works great. Now, talk to us, this whole coronavirus situation, how are you doing personally and how it has affected your work?
Well, we've pretty much stopped all the operations. We had a lot of cases that were booked and a lot of patients that were scheduled to have their cosmetic surgeries. And we initially canceled everything that was during the late March into April. We thought the first set of ordinances would end in April and we could resume our operations. That didn't happen, and now it's into May. And as you can imagine, there's a lot of patients that are frustrated. They're very understanding, but still frustrated. There are a lot of kids that want to have their rhinoplasties during their spring break, and people have taken not only time off, but family to come take care of them and spend their money to get the cases in, and just it's not being done. So that's a bit of a frustration. What we've done is stay open, however, for our reconstructive cases that are urgent or any patients that need us for post-operative care.
What is the most popular plastic surgery that people are going to you for in general? Is it the breast, butt lifts, nose jobs? Lately, I've seen a lot of new chins. Like leading ladies now have chins and dimples that I didn't notice before. Is that something new? Tell us, what's the most popular plastic surgeries request going now?
Right. Some of the new things right now are actually using facial fillers to augment the face, add to the cheeks, add to the chin, give a nice jawline like yours, a nice square jawline. A lot of guys come in and want to develop it like that. So
wait, guys develop the jawline? This is all natural.
Well, natural, yeah. Well, you're lucky.
What could you do to make my jawline better?
I think that's pretty good. It's pretty square as it is. So that's kind of what we want to shoot for people that don't have a strong jawline or nice high cheekbones or a strong chin. And in the past we had to use silicone implants or any other kinds of med-pore implants. And those were, bigger surgeries, and people were a little bit more hesitant to walk in and do that. But now you can just do it with just a syringe. You put the needle right in. You have to put it in the right place, obviously. But we have fillers that last 2 to 7 years, and
wow,
you can really, augment those areas and get a much better jawline, better definition. So that's pretty exciting. So
the cheeks, the fillers last 2 to 7 years. It's not like Botox where it has to be.
People that we say we have this word called a negative vector, where the cheeks are pretty far back and everything's kind of droopy. Mm-hmm. So for those people, we could build up the cheeks with a calcium filler. It's basically like toothpaste. It's calcium, and you basically go right next to the bone and you inject it, and actually some of it incorporates with the bone. So it really becomes like a natural implant, and you can get that nice high cheekbone. And also what it does, it lifts up the face, it gives more volume. As we age, we lose a lot of fat and volume in our face, and we can replenish that to maintain our looks.
I've seen a couple of reports with breast implants, how they were done in the past with silicone, people claiming that they're getting sick because of it, that it's affecting their energy levels. What are your thoughts on that? And have you gone away from silicone, strictly saline, or people that had implants decades ago, are they in danger now, doctor?
I think about when I heard a lot of this happening was about 6 months ago, where the textured implants, those are kind of like sandpaper, and these were created to minimize the risk, the complication we call capsular contracture. That's when we create the pocket, and this pocket just squeezes on the implant. No matter how soft this implant is, it's going to feel hard because the pocket around this closed down. So these textured implants were supposed to minimize that risk, and it did in certain situations when you put them above the muscle. But these implants were associated with a very rare form of breast cancer. And for that reason, they were pulled off the market with Allergan. And I think at that time, we heard a lot of patients, talking about how the, implants were making them feel sick. And I haven't seen any data to prove that, to show that it really does cause any illness. But I think, just so much talk about it makes people think about it and makes them feel a little bit uneasy about it. Now, the saline implants have the same outside shell. So it really doesn't matter which one you use. They're, the outside part's the same kind of a silicone.
I love having this show because I get to talk to people about things that I normally never would. I would have never thought about changing my face or my nose or anything, but that's just me. That's why when I lost my hair, I said, forget it. I'm just shaving it. I'm not gonna get implants. What do you say to people when they come to you and they're just very unhappy with themselves? What is the part of, because you're part psychiatrist also, am I right?
That's a cliche we talk about a lot. There's different shades, and I think I'd say 99% of patients that come to me, they're very nice, they're very reasonable, their expectations are very normal. A good majority of my patients are moms. They've had kids, they have a lot of loose skin, the muscle's been stretched out, and you can exercise as much as you want. I have athletes that come in and their muscles underneath are rock hard, but then the skin's just loose and you can't do anything about it except remove it. So that's the majority of my patients, and they're very reasonable. As far as facial cosmetics, you're lucky. You're a very good-looking guy, and you don't need anything.
Thank you, Doc. I think this can go up a little bit, though. Could you do that for me?
There's people that come in that, they're getting in their 40s and 50s, and they're saying, hey, you know what, I'm kind of looking raggedy, and I'm getting these really deep lines, or I have these bags under my eyes, and it just makes me look tired. I don't feel tired. I have all the energy, but it's just not me. And, I don't think you want to make everybody perfect. If somebody wants to come in and look perfect, that's not reasonable. You want to fix something that's bothering somebody every day. It's a legitimate, you can see it's a, more than ordinary. And you can pick flaws in everybody. Our job isn't to pick flaws. Our job is to see what's bothering that specific patient. Something's really bothering him every day. Is it something legitimate? And then correct it and make him feel better about themselves. Now, sure, if somebody doesn't like themselves and they're looking for plastic surgery to make themselves feel better, then that's a problem. Yeah, you want to get to the root of the problem and fix that.
How many plastic surgeries have you done where you were shocked at even what an amazing job you did? Was there anyone that you're like, I knew I was going to make you gorgeous, but wow, I outdid myself? Has that ever been the case?
I would say, well, okay, you got to be humble answering this question.
Well, you called me good looking, Doc. I thought I'd lay one up for you, but I honestly want to hear if that's ever happened.
Okay, honestly, some of the cases are just, they miraculously change your body, like the tummy tucks. You have this, a lot of loose skin, the muscles stretched out, and you can go there before and after and look at them. And I'd say initially when I came out of practice, the first 3, 4, 5 years, I wasn't very, very happy with, with the results. So you have to focus on what you can improve, not just say my work is great. And I try to keep doing that, making the belly button look more natural, making the scars super thin, keeping them low, making the scar invisible so there's no dents. And then when you look at the after result, you basically have a beach body. You have somebody who has this, all this extra skin, bulging belly, and then they have like, sometimes the moms come with their kids and they're like, I look better than my 19-year-old daughter now, and she's jealous of me now. So some of those procedures are great. They just make you feel really good. Same thing with rhinoplasties. There's, a lot of patients that have, just the nose doesn't fit their face, and they have a lot of breathing issues too at the same time. So, you fix that and you look at it afterwards and you're like, hey, great, wow, I did that. And it makes you want to do more, makes you feel good about yourself. And the patients, return that. So it's a lot of positive energy going back and forth.
I love the positive energy going back and forth with you and I right now. Dr. Michael Omidi, thank you so much for being on. Tell everyone where they can find you, where they can get a consultation, even virtually, or where they can find you on social media, sir.
My website, michaelomidi.com, and my Instagram's drmichaelomidi, and I'm available anytime for you or my patients.
Thank you so much, Doc. And final question, what's your go-to song that like the song right now you're listening to?
The go-to song right now,
Or singer or music?
I would want to hear The Doors.
Nice.
Light My Fire.
Very nice.
Yeah.
Very nice. And with that, we say goodbye.
Get on my elliptical at home and start working out.
Can you sing a little more? A little.
Can I sing it? No, I'll pass that one.
Come on, baby, light my fire. Thank you so much, Dr. Michael Omidi, one of the best in the world. Hopefully, this nose will stay perfect, but if I break it, I'm coming to you to fix it up.
Thank you for having me. Thank you, Pablo.
Thank you, Doc.